The message about the power of activism by everyday women has so much resonance right now, and that is because we are at a historic moment in our nation's history when, for better or worse, the country is changing, the economy is changing, and women's roles are changing. The National Partnership for Women and Families is making sure that our laws, programs, and policies change as well. Today, women hold jobs when we are young and single, when we are mothers, and when we are grandmothers. We care for our children as well as our parents and our husbands. And we are the consumers as well as the caregivers for our households. And we have the right to expect our society to be free from discrimination and our workplaces to recognize the challenges associated with being both a working mother and a working daughter. And now I'd like to introduce someone who is doing as much as anyone to make sure that those expectations are realized, someone who is working tirelessly to transform our workplaces and our healthcare system. National Partnership for Women and Families President Debra Ness is a passionate fighter for the kinds of healthcare and work-family policies that will make this nation better. Please join me in welcoming Debra Ness to the stage.
Thank you, and thank you for once again being such a wonderful MC. And thanks to all of you for being here today as we celebrate the power and progress of women and as we rededicate ourselves to using that power to forge policies that make this a better country. In this election season, newspapers and TV are filled with stories about the rise of women in power. But it's the rise in the power of women that isn't getting noticed. That transformation is affecting every aspect of American life. In just the past few years, our economy and society have changed in ways that are fundamentally changing our lives. Today, America's women are half of our workforce and the primary breadwinners in 40% of our families. But we're also still the primary caregivers in our families, increasingly managing care for our aging parents, as well as taking care of our kids, ourselves, and often our spouses. An earlier generation of women proclaimed we could have it all. Today, women are being asked to do it all. But we're being asked to do it all with one hand tied behind our backs, with policies that don't reflect the realities of 21st century American life. You've all heard that great Ann Richards line about how Ginger Rogers did everything Fred Astaire did, but she did it backwards in high heels. Well, today, America's women are being asked to do so much of our nation's work in our homes, our workplaces, and in the corridors of power, but saddled with policies that are as outdated as an MGM musical. Women are still paid less than men, even though our families depend on our income. Reproductive choice is still under assault and becoming more and more scarce, even as discrimination against women who are pregnant and have children is on the rise. Women are filling their role as parents at the same time they're caring for their own aging parents. Yet our workplaces still don't account for the dual responsibilities that most workers face. You know, it was once said that behind every working woman is an enormous pile of unwashed laundry. And today, that pile of unwashed laundry is growing, along with the pile of unfinished work, unpaid bills, unused treadmills, and unfunded 401ks. Something has got to give. So yes, we should celebrate the fact that after generations of struggle, women have expanded their roles. But as America's women now do most of America's business, it's time we change the way America does its business. And if the past year has taught us anything, it's that real change, dramatic change, transformative change is possible We've seen it happen, and the National Partnership, along with so many of you, helped make it happen. I can still feel what it was like in that very crowded room on that spring day not so long ago to hear President Obama say that after a century of striving, after a year of historic debate, after a historic vote, healthcare reform is no longer an unmet promise. It is the law of the land. What an incredible victory. But this is also a moment to dedicate ourselves to the even harder work of translating healthcare reform into practice. That's why the National Partnership, together with many in this room, launched the Campaign for Better Care. Getting reform right is what the Campaign for Better Care is all about. Giving voice to our most vulnerable patients, especially older adults and those with multiple chronic conditions who are the heaviest users of health care with the highest cost and often the poorest results. We are building a thriving base of activists that will push and prod our leaders to get things right. And we're already seeing the power of this movement. This spring, HHS issued a proposal to give incentives to those who would adopt health information technology in ways that would actually improve care for patients. Some said these incentives would be too hard to achieve. But our activists sent thousands of emails encouraging Secretary Sebelius to stand her ground for meaningful reform. The campaign is going to provide the backup so that those leading the way don't need to back down.